Hello, my name is Claus Buergelt. I'm a veterinary pathologist with the Department of Pathology, College of Veterinary Medicine, University of Florida in Gainesville, Florida. I'm very delighted to be here to share with you my experience with the pathology of wildlife species, and I would like to thank the C.L. Davis Foundation to provide me with this opportunity. I also would like to thank the faculty and residents in the Department of Pathobiology and colleagues within the university and outside the university that helped me to put the slide series together. And I would like to start with my first slide. And introduce the first topic as being terrestrial wildlife pathology diseases, and these are the species that I would like to discuss. Starting out with the deer, as far as the state of Florida is concerned, we do have a very small type of deer known as the Florida key deer and then the white-tailed deer as well. The diseases that I had to deal with affected various organ systems and were the result of various causations. Starting with diseases affecting the cerebral tissue, in particular the brain, many male deers developed abscessations and a purulent exudate overlying the meninges from fighting and broken antlers. Here is such a surface of such a deer showing a hyperemic reaction, and on cut section the abscessation, the extent of the abscessation becomes evident in various areas of the brain. It is typically a seasonal disease and in the vast majority affects male deer. The meningeal worm is visible in and on meningeal surfaces. It is known as Paralephostrongylis tenuis, and it needs snails and snakes as intermediate hosts. It is a blood-sucking nematode present as a hair-like structure, stained reddishly, and it rarely does involve the brain. There is a mild reaction to it, but by and large it is just a parasite that oversits the meningeal surface in the brain and also at times associated with the spinal cord. This is a case of dermatophilosis, also known as rain scale, causing a dry exudative dermatitis in this deer, but it may involve the conjunctiva as well, and at that time may lead to blindness that may lead in itself to starvation, a difficulty to find food. A severe case of Fibropylomatosis affecting the skin of the neck and head area, but also visible on the conjunctiva, probably leading as well to disturbances of vision and ultimate incapability to feed and starvation. A case of Nasal Adenocarcinomatosis affecting the nasal cavity as well as the frontal sinuses is seen in this split head. Nasal bots behave just as nasal bots in sheep. The deer has its own species. They are present in the nasal cavity, but also in the oropharynx area as seen here, and in many instances are incidental findings in such affected deer. Lungworm disease, viviparous Dictyocaulus viviparus affects the airways as far as the adults are concerned, but deer do develop a verminous pneumonia. This is a case of pericarditis extending from a existing pneumonia leading to a constrictive pericarditis and being characterized as a thickened pericardial sac. A virus disease that is a relative to the blue tongue virus and orbivirus induces a disease in deer that is known as episodic hemorrhagic fever. It is a multi-system disease that affects the clotting system but also the mucosal integrity, and it's characterized by hyperemia, ulceration of the GI tract, the upper respiratory system, and it affects other internal organs as well. Here we have the opened rumen from such affected deer, revealing a confluent, extensive hemorrhagic surface, in a surface being the result of a hyperemia and ulceration. A incidental finding in the mucosa of the esophagus is due to the presence of Ganglionema pulchrum, a small thread-like nematode that inhabits the mucosa and lamina propria and rarely induces any evidence of esophagitis. Deer suffer from liver flukes, mainly being result of infestation with Fascioloides magna and Fasciola hepatica. This is a case of Fasciola hepatica, liver fluke infestation. This is a case of vertebral fracture resulting from attempting to capture a deer. It led to immediate death due to a separation of the spinal cord. An accidental finding and incidental finding associated with the kidney of a deer resulted from the presence of lymphosarcoma. On to black bear. It is estimated that there are presently anywhere between 1,000 and 1,500 black bear in the state of Florida. They have very few natural enemies. The number one enemy is man. Many of these are dying from collision with cars as road kills. Certain diseases that may be found in these black bears are demodicosis and salmonellosis, salmonella causing an enteric infection. Here is a case of discospondylosis resulting in paresis, paralysis, and lameness, and probably starvation from not being able to feed. A case of focal fibropylomatosis associated with a portion of the skin in such black bear. On to bisons. In the neighborhood of Gainesville is a prairie known as Plains Prairie. Attempts to introduce bisons into this prairie failed because many of them developed brucellosis and had to be culled because there was a threat to infect the surrounding livestock. Typically, such animals miscarried, had abortion from Brucella abortus, and the males developed changes associated with the epidermis and the testis. Here we have evidence of a case of Epidermidis. Wild hogs, mainly seen and present in the southern part of Florida, are presently anywhere between 1,500 and 2,000. Here's a picture of free-roaming wild hogs. They suffer from a couple of infectious diseases, starting with Augetskis, being characterized microscopically by a lymphocytic, non-purulent panencephalitis and the presence of nice herpes intranuclear inclusions as depicted here in this neuron. There's also evidence of Brucella orchitis, biotype 1. A cut section through such an affected testicle reveals a hemorrhagic necrotizing orchitis. The kidney worm Staphylococcus dentatus affects the pelvis of the kidney and induces a periurethral inflammation, with the adults being visible in such affected tissue. Excuse me. Coyotes. A few are present and seen in Florida. They do not suffer from rabies, but develop a distemper as well as parvovirus enteritis, and frequently are carrying heartworms without developing heartworm disease. Here is an opened heart, right ventricle, to show the adult Dirofilaria emittis from such a coyote. Opossums. Many of these animals die from roadkills. They are, however, thought to function as the intermediate host for the protozoan, inducing the equine pyrazole myelitis, known as Sarcocystis neurona and or Sarcocystis falcatula. Here is a swollen head of an opossum suffering from nutritional fibrous osteodystrophy. This particular animal developed congestive heart failure and becomes quite evident that the heart occupies a large volume within the chest cavity, and also there's evidence of hepatomegaly, a moderately enlarged liver. Upon removal of the plug, it becomes evident that the atrium is quite distended, and also the heart appears to be enlarged. This is evidence of a peritonitis, a hepatitis, a splenitis, and nephritis resulting from an acid-fast disease. As far as the microscopic appearance of the liver is concerned, the presence of typical granuloma formation cannot be seen. Instead, there's evidence of lymphocytes and plasma cells. There's a little bit evidence of necrosis, and a special stain is positive for acid-fast organism. This is a very unique case affecting the pituitary of an opossum. We are looking at the base of the brain with the optic chiasm being visible here. The medulla oblongata and brainstem area being here. There is a significant enlargement of the pituitary visible in this particular photo, and it is the result of an adenomatous change, a proliferation of intermediate chromophobe type of pituitary cells growing towards the unaffected part of the pituitary, and it was ultimately diagnosed as a pituitary adenoma. Physoloptera are frequent inhabitants in the stomach and in small intestinal tract of opossums. The reproductive tract, particularly as far as the external genitalia of the male opossum, is quite interested in that normally the males have a diphallus, a duplication of the penis. In other species, that would be considered to be a pathologic abnormality. It is a quite normal finding in the male opossums. Likewise, the female reproductive tract is characterized by a duplication of certain portions of the uterus as present here. There are two sets of uterine horns and a duplication of the fundus of the uterus and one set of ovaries. This is a litter of opossums, 5 of them being in a pouch-like structure surrounding the nipple. Amadeus, it's typically the 9-stranded Amaldio that is, or 9-branded Amaldio animal that is inhabiting the wild environment in the state of Florida, but also extending over the entire southeast. It is an animal that is frequently killed by car, so road kills are events that happen quite frequently. But it is also used in a colony to cultivate the lepra bacillus in that it facilitates a environment whereupon the Hansen's bacilli may replicate and be then used for research purposes. And here is such a granulomatous dermatitis with the presence of acid-fast organisms being compatible with the Hansen's bacillus. Skunks have the typical diseases that skunks have anywhere else. Here's a case of a dry, crusty dermatitis affecting the skin, the ears, and the legs, looking very much like a possible case of distemper, but it is not. This is a vitamin C deficiency disease leading to hyperkeratosis and alopecia. This skunk, however, shows clinical signs of conjunctivitis and nasal discharge, as can be seen associated with canine distemper. The lungs, characteristically at the gross level, will show very little pathologic changes. However, this one is revealing an uncollapsed scenario and a firmness to the texture, and indeed it was a proliferative type of pneumonitis. Nematodes known as Scribingulus situadorum may induce a sinusitis and a meningitis in skunks, creating a clinical picture that mimics canine distemper, virus infection, and or rabies. These are blood-sucking nematodes that become easily and readily visible in the frontal sinuses and the dorsal surface of the meninges. A set of ascarids from skunks, and then a case of a duodenal ulceration leading perhaps to intraluminal hemorrhage. This is a case of lymphomatosis in a skunk affecting the liver mainly and inducing a hepatomegaly And here it is again, a pallor to the texture, and maybe a slight rounding of the edges suggests a liver filling infiltrate. In this instance, this was due to neoplastic lymphocytes. Squirrels, squirrel fibroma can be seen in squirrels in the state of Florida, and as everywhere else, they typically reveal themselves, the changes reveal themselves as proliferative nodular lesions. Microscopically, the squirrel fibroma being result of a pox virus infection induces a hyperkeratosis and some kind of connective tissue proliferation in the subcutis and dermis, and there's evidence of metastases to the lung as well. Here's a squirrel that has a drain in the dorsal calvarium, the head being here. This is the dorsal aspects with some head, some hair being shaven away. The tubing was meant to drain an exudate off the meningeal surface, and indeed this animal had evidence of a severe purulent meningitis that was the result of a bacterial infection. A microscopic picture reveals the magnitude of the neutrophils with bacterial colonies being readily visible in an H&E preparation. Hedgehogs in Europe are wild animals. In Florida are pets and gain increasing popularity. I just want to share with you a couple of disease entities as they were seen in such animals and were diagnosed by my colleagues from the Department of Veterinary Pathology. One such case was a nephrosis with desquamated epithelial lining cells being visible in these tubules. Another case was a multisystemic mineralization associated here with the myocardium of the heart. And the third case was the development of a squamous cell carcinoma in the tongue with the regular uninvolved squamous cell lining being visible here and the tumor proliferation in this part of the photomicrograph. Otters, there are two types, one being a river otter, the other one being a sea otter. As it relates to the state of Florida, the river otter is seen more frequently, and on occasions we had the opportunity to do a necropsy on demised otters. This one reveals evidence of congestive heart failure with an enlarged heart and an enlarged liver being seen here in this in situ photograph. The diseased heart is characterized by a rounding of its contours, and there's evidence of congestive heart failure along with some kind of fibrosis affecting the pleural surfaces. A second case of otter disease affected the kidney to induce urolithiasis or renal stones, effectively causing a shrinkage and or atrophy of the kidney. Typically, the kidneys of otters are lobulated, as we can see them in whales, and bears, and cattle. Onto the second tray of slides, and I would like to introduce a very special friend of ours known as the Florida panther. The Florida panther is a subspecies of the cougar and known as Felis concolor corii. It is a close relative to the western cougar, but very unique to the state of Florida. It is presently felt that there are anywhere between 30 and 50 animals left in the wild. It is an endangered species and also the official state mammal of the state of Florida. It is a unique and very skilled hunter living off the deer population and the wild hogs that I previously have introduced to you. Its main habitat is in the southern part of Florida. There are two main areas where presently the remaining 30 to 50 panthers are found. One is the Everglade area. The other one known as Big Cypress National Park, which is here. A major highway connecting Naples with Miami cuts through the main inhabitant areas and is the imminent threat to the remaining panthers, as we will see. The features of these animals, typically a grown-up male will weigh between around 150 pounds, the females being smaller. The female becoming sexually mature at age 2 to 3 will have a litter of 3 kittens after a 3 months period of gestation. The Florida panther lives off the tree. It is a nocturnal hunter, ambushing its prey very frequently. Here is a set of kittens being characterized by dark spots in the pelt, facilitating the blending in with the environment. Typically, these kittens are dropped off in small caves or hollow trees and are sheltered thus. Certain characteristics of the Florida panther are very unique to this subspecies, starting with white spots indicating an absence of pigmentation, a case of Leukotrichia. There is something in the skin affecting the neck or dorsal back area known as cowlick, a whirling and swirling of hair. And thirdly, the distal tip of the tail is kinked in that 2 or 3 vertebrae are dislocated. So a kinked tail, cowlick, and the Leukotrichia are characteristics with the outside appearance of the Florida panther. The Florida panther, living in its environment, has problems that affect the health. These problems are relative to meager years, whereupon the deer and wild hog population is not enabling the panther to consistently feed on. It develops anemia due to the presence of ectoparasites as well as endoparasites such as hookworms. It carries certain viruses without suffering disease from them. These are typically the feline panleukopenia virus, the calicivirus, the feline infectious immunodeficiency virus, and feline leukemia virus. Lately, the remaining male panther population suffers from a reduced sperm count, and we will find out the reason for this. And both adult female and male panthers have developed evidence of an atrial septal defect at the site of the ostium secundum. We will have some demonstration of the cardiac malformation very shortly. The remaining panthers are consistently surveyed by a team of wildlife specialists that includes biologists and veterinarians. The animals are supplied with a radio color. They are monitored relative to their blood and renal function. Skin samples are taken for DNA analysis, and they are immunized against rabies. This is not an easy task in that the animals need to be tranquilized and require darting, as many of them are living off trees. The safety provided from not inducing fractures or any injuries from falling off a tree after tranquilization are various safety nets. So despite of the fact that the overall population appears to diminish, the veterinary care of the remaining Florida panthers has increased. The main problem that the animals encounter are roadkills and occasional poaching from hunters. Also, the habitat changes. The Florida panther does not have a large area for its roaming and hunting needs available, so many of the problems are due to mankind. We at the University of Florida, the College of Veterinary Medicine, are involved in the complete necropsy of demised animals that are immediately after detection of being dead are shipped to the University of Florida College of Veterinary Medicine for a complete necropsy that includes the weighing and measurements of organs. Certain portions of the flora, in particular the hide and skeleton, are retrieved for the Florida Museum. Many samples are taken for tox screens, and tissues upon request, special requests, will be provided for research activities. Here's such an unfortunate animal dead on the necropsy table. And I would like to provide you with a cohort summary of 36 Florida panthers that I had the opportunity to do such a complete necropsy on. The cohort consists of 23 males and 13 females, ranging in age between 2 weeks and 14 years, with the mean age being 4.8 years. The mean age of the male population was 4.5, that of the female slightly higher. Both of them, however, were necropsied at the prime of their life. Out of these 23 males, half of them had evidence of either unilateral or bilateral cryptorchidism, and 6 animals had evidence of an atrial septal defect at the site of the foramen secundum. Examples of individual categories of causes of death. This case was a acute death to trauma after collision with a car, whereupon this unfortunate animal developed multiple traumas to the calvarium that resulted, and the bones of the nasal cavity and face that resulted in fatal hemorrhages associated with the brain. Other animals that are colliding with cars are not instantly killed, but do develop focal injuries, such as depicted in this slide, a coxofemoral joint from a panther that developed a subluxation, as well as a pseudoarthrosis and severe thickening of the capsule, probably causing paresis and a incapability to hunt. This animal most likely might have died because of starvation from this chronic trauma. A recent case involved a young female that developed in one of her front legs a severe diffuse swelling that extended from the pores all the way up to the shoulder, and it becomes quite nicely evident as compared to the uninvolved front leg. This animal obtained a wound that started at the side of the shoulder and might have been very well the result of fighting with another female and or male. Here is the healed surface of this wound, created, however, multiple abscessations in the subcutaneous tissue and a severe diffuse cellulitis due to the presence of a variety of gram-negative and gram-positive bacteria. 2 panthers died because of a severe diffuse pneumonia. Here is the opened chest of one such affected panther, showing a plum coloring of the entire lung, which reveals itself as such nicer upon removal from the chest. This particular lung on touch felt very, very firm, and on cut section almost assumed the appearance, both in color and also upon touch, of a liver. It was a result of 2 processes. One that caused extravasation of red blood cells into the alveolar space, and a type 2 pneumocyte proliferation of alveolar pneumocytes. This looked very much like a toxicosis from paraquat consumption, except for that where the animals were found, paraquat was not used. A different herbicide was used that contained a substance that we were suspicious of being the culprit, kerosene. among others. However, upon analyzing the lungs for evidence of kerosene or kerosene-like substances, we were not able to demonstrate our suspicion. Kerosene, however, if consumed by accident by dogs and cats, has been reported to induce a proliferative diffuse interstitial pneumonia resulting from a permeability disturbance at the site of the capillary, the endothelium of the capillary, and due to a death and necrosis of type 1 pneumocytes. Only one case of rabies was diagnosed in these 36 panthers, just to demonstrate that rabies cannot be diagnosed at the gross level in that there are no changes associated with the brain. Nicely, however, microscopically, the presence of negri bodies in the cytoplasm of neurons makes the pathognomonic and etiologic diagnosis of rabies virus infection. 2 panthers that were kept over a lengthy period of time in captivity developed a chronic CNS disease resulting from a leukodystrophy that was characterized by myelin loss, a spongiosis of the neuropile, and some evidence of thermistocytic reactive astrocytes. It is felt that this lesion might be the result of a nutritional deficiency disease. The precise nature thereof has not been elucidated as of yet. A congenital disease that affected the heart and led in some of these animals to congestive heart failure was seen at the site of the atrium. Here is a good example of a large atrial septal defect being characterized by a fibrous structure at the periphery, a fibrous band, and then a communication between the right and left atrium. This type of disorder affects the reproductive tract of the male panthers mainly, and it is a result of a failure of either one or both testes to descend. Excuse me. Here is a normal set of mature reproductive system tissue from a male panther with 2 gonads, the epidermis being closely attached with vas deferens, the accessory sex organs being mainly the prostate and the penis. In cases of unilateral or bilateral cryptorchidism, infertility is the result, and at the microscopic level, such a testis does not show normal mature spermatogenesis. Instead, the germ cell epithelium looks very immature and very unproductive. In the females, on occasion, there was evidence of a proliferative change associated with the vestibule and the vagina, diagnosed as proliferative ventriculovaginitis. Attempts to isolate a cause, identify a cause and isolate an agent failed. One certainly is inclined to think of either a papillomavirus being the result of this change and or herpes virus, but neither one were identified for various techniques. Here is an open stomach from a panther dying from bleeding into the stomach. Here is a liver showing white spots associated with the surface, but also on the parenchyma, suggesting a hepatitis. Incidental findings were associated with the thyroids, leading to an enlargement, but no disease associated with the thyroids, excuse me. Dracunculosis is a subcutaneous worm, an incidental finding as well. In summary, then, various categories of mortality were appreciated, the largest one being trauma, either resulting from car collisions or fightings. Other disease, this affected certain organs, such as the lung, the central nervous system, and the heart. A large percentage of categories of mortality remained undetermined due to the fact that some of these animals were simply too decomposed. Causes of mortality heavily centered around traumatic influences versus very few endogenous diseases, and again, half of the cases remained undetermined to the precise cause of mortality. What can be done in order to save the few remaining animals of the Florida panther? A couple of solutions are listed here to create a better habitat. Road underpasses facilitate a crossing of major highways in a safer fashion. Captive breeding programs can be pursued. The creation of genetic diversity to avoid inbreeding and a genetic paucity can be achieved from the reintroduction of the cousin of the Florida panther, being the western cougar. And another solution is to remove all panthers from the wild and keep them in captivity, and hopefully increase the number that way. A couple of western cougars were reintroduced to Florida. We were able to do the necropsy of 4 of them, and 2 of the 4 had changes associated with the lung. This one had a mycotic thromboembolic pneumonia, and another one had evidence of coccidiomycosis as a agent that has been introduced and imported to Florida from the southwestern states. This is a listing of the 4 cases that we did. All 4 of them were males. 2 of them had changes with the lung. 1 had renal failure, and 1 was. Okay, then let's continue with the critters that fly. We so far covered aspects of diseases that we were able to see associated with terrestrial mammals. On to birds and bats. And here are a couple of examples of bird diseases as we were able to see them at the College of Veterinary Medicine. These are prey birds, seabirds, wading birds, and ratites as they played a role at certain times and were introduced to the state of Florida. And then I will conclude this segment with some bat diseases. Here is an eagle, the symbol for the nation, a bald eagle, and frequently these were traumatized through various ways. This is a bald eagle showing a fracture associated with the wing that was supplied with some screws but failed to heal. Here is another case of trauma to the wing of such an eagle. Here is an opened calvarium from an eagle that was traumatized to the head. And here is a hematoma associated with the solemic cavity. So evidence of trauma is interfering with the well-being of the eagle. Here's a case of coelomitis and hepatitis resulting perhaps from infection with fungi. This one, however, was a severe hepatitis resulting from infection with E. coli. Here's the heart of an eagle that died because of myocardial fibrosis with some evidence of mineralization and inflammation, cause unknown. Here is a case of air saculitis and lung disease secondary to aspergillosis. And indeed, the exudate, when stained, specifically revealed evidence of the hyphae. Eagle pox was a nice change associated with the legs, a proliferative dermatitis that showed beautiful evidence of cytoplasmic inclusions known as Bollinger bodies. Osprey, every so often, do not make it very well. Here is a picture of such a hunter with most likely half a fish between his legs. This one had a exudative mineralizing coelomitis coating the serosal surfaces and being result of aspergillus infection as well. Wading birds are frequently seen in the marsh portion of the state around lakes and wetlands. This is a picture showing sandhill cranes as they migrate to Florida to spend the winter months in a friendly, hospitable climate. A case of air saculitis and coelomitis secondary to aspergillus infection affecting a sandhill crane is seen here. This is a beautiful case of granulomatosis affecting the liver. The removed liver is characterized by the presence of multiple miliary foci, and here is the spleen. It is a result of a necrotizing granulomatous inflammation that shows many giant cells and macrophages in the periphery of such granulomas. When stained specifically with acid-fast stains, it becomes evident that the culprit is that of M. avium intracellulare, which this one was the case. A case of small white foci affecting the heart of a sandhill crane and ultimately the liver resulted from visceral coccidiosis, Eimeria species affecting the heart and the liver as seen here. A heart that is coated with a dry, chalky type of exudate turned out to be the result of visceral gout. A piece through the wall of the proventriculus reveals white areas affecting the musculature, resulting in the diagnosis of white muscle disease. Many times peanuts undergoing mold infestation that resulted in mycotoxicosis, resulted in either a multifocal confluent hepatitis, killing sandhill cranes as seen here, and or true tumors associated with the liver that were diagnosed as cholangiocarcinomas or adenocarcinomas. And here's such an affected liver, whereupon the hepatocytes have been replaced by neoplastic biliary epithelial cells that have induced a desmoplastic reaction. Mycotoxicosis, as in other animals in these sandhill cranes, resulted in liver disease, be it inflammatory or be it neoplastic. A second animal that is rare overall is the whooping crane, but shows up in Florida. Whooping cranes are delicate animals that are surveyed quite frequently as far as their migratory pattern is concerned. As far as death causes are concerned, one major category involves power lines or fences that result in fractures and traumatic lesions. Another type of disease category again is acute mycotoxicosis from moldy peanuts that cause liver disease as previously shown, and in chronic situation cholangiocarcinoma. Predation by bobcats is a third type of category, and visceral coccidiosis being a internal disease entity, as well as certain helminth parasites. Here is a helminth parasite that affects wading birds, not necessarily whooping cranes and the central cranes only, but the egrets or something like this as well, known as U. strongylus. The adults being present on the serosal surface of the stomach and or small intestinal tract, and with larvae being visible in the wall of the affected organs. Here is an adult in between the two layers of a serosal surface, most likely one being the gut, the other one being the proventriculus. Okay, then let's continue with the diseases of wading birds, in particular as they are caused by a nematode known as U. strongylus. This next picture is from a loon that suffered from the same helminth and shows a hemorrhagic involvement of the gizzard and also of portions of a small intestinal tract. All of this being a result of infestation with U. strongylus species. Here is a barn owl. Many of these animals have evidence of hemoproteus affecting blood cells, which may or may not lead and precondition them to other diseases. Here is a hawk that developed again evidence of aspergillosis affecting predominantly the lungs. Here is a kite with the same type of disease, and here is a aspergillosis in a seagull. So on, as it seems, several occasions. Aspergillosis is a problem for a variety of birds in Florida. The pelican is a frequent inhabitant of coastal areas, and this one has evidence of white muscle disease, a degenerative process affecting major muscle groups, being characterized by a paintbrush pallor, and microscopically being the result of degeneration and mineralization of both skeletal muscle fibers as well as hard muscle fibers, as seen here. Perhaps this chap ate too many fish, but it is very much and reminiscent of what is seen in mammals as a nutritional deficiency disease known as white muscle disease or hypocellulinosis. On to some diseases affecting pigeons. Here is Pigeon Pox, being characterized by proliferative changes associated with the eye and the beak. Here's two brains from pigeons, one showing a swelling and enlargement resulting from abscessations. And here is a pigeon that developed lymphomatosis affecting the liver, as seen here in situ. Quails do not do very well in Florida because of not finding the appropriate environment. However, they are maintained for hunting purposes. Here is evidence of a Japanese type of quail that developed a egg-bound peritonitis, as seen here. Here's one that looks emaciated, a Japanese quail resulting from infection with Clostridium cholinum to induce quail enteritis or an ulcerative enteritis that is present as transmural infection. It is characterized by severe necrosis with a magnitude of clostridial organisms being already visible at the microscopic level. And lastly, an outbreak of salmonellosis in a local area that killed a lot of cardinal birds was the result of a contamination of a cardinal feeding area from cowbirds that contaminated the feeding area of these cardinals that demised in large numbers. It's a beautiful animal that really brings a lot of, as far as the males are concerned, color to the state and is present in a variety of backyards and gardens and front yards, and it probably was a sad scenario to see many of them dying, and one of our residents was called to the scene and diagnosed the cause to be the result of salmonella infection. And here is a spleen from such a dead cardinal showing necrosis, coagulative necrosis, and some bacteria in the center. Here is a section through the brain showing the magnitude of bacterial colonies being present in multiple areas. And here is a through section through the esophagus showing a laminated exudate and presence of Salmonella organism. On to marine mammals, and here's a list of those that I would like to cover. The manatee being perhaps very unique to the state of Florida, and on occasions we were able to do some necropsies on dolphins and whales. As far as the whales are concerned, altogether 6 as listed here. The manatee is very unique to the state of Florida, as I indicated, and also endangered as a species. I had the opportunity to perform necropsies on several of these animals as they presented and were salvaged within the state. It's a herbivore that is also known as sea cow and feeds off the seagrass that grows plentifully in coastal waters or very shallow areas of the coastal regions of Florida. The manatee again is protected by various federal and state laws, and various programs were instituted in order to protect the manatee against non-favorable environmental factors. As far as the College of Veterinary Medicine is concerned, a joint program was instituted with the Denver Wildlife Research Center and the university to perform necropsy on freshly salvaged manatees, and I would like to share my experience with you of these animals. Here is a team assembled to perform a necropsy, and it all starts with the meticulous measuring of various structures, external structures or organ systems of the manatee. We did the same with the internal organs as well. And just like with the Florida panther, various tissues were collected for tox analyses and also to be shared with research colleagues depending on the type of research. The anatomy of a manatee is of certain comparative interest in that it has a very large intestinal tract that is the result of being mainly small intestinal tissue and large intestinal tissue. This is all colon looped out, and here we have the stomach that contains 2 ear-like ampullae that are involved in the digestion of manatee feed. The manatee does have a separation between the chest and the abdominal cavity through a diaphragm that is seen here and here, and again is a horizontal structure that clearly separates the lung. Here is a set of lung, very fresh and normal, with bronchi and the trachea being visible here. These are the gastric duodenal ampullae that, when opened, look like a gland, in that there is evidence of lobulation, and they do function as a digestive gland. producing and releasing secretions into the stomach, which is partially shown here, which is a true stomach with a true glandular mucosa. Due to the fact that the manatees are mainly swimming underneath the water, the long bones are solid and porous, and do not contain bone marrow. And for a while, we were not quite sure what tissue and where the bone marrow is, but it is present within the bodies of the vertebra as seen here. The spleen is impressively small, considering that a mature manatee may be weighing anywhere between 1,500 and 2,500 pounds. The largest that was necropsied weighed 3,400 pounds, and that is quite a considerable weight to deal with. So the spleen is a very small organ normally in such manatees. Here is a set of nasal flukes, a non-pathogenic inhabitant of the nasal cavities of the manatee. The heart is of interest too, in that it is richly endowed with coronary arteries, and it has a normal fissure separating the two ventricles. Internally, the heart impresses through a rich net of papillary-like muscles, as one can see here in this opened ventricle. Reproductively, the animals become sexual mature anywhere between 2 to 5 years. The males have internalized testes, and here is the entire male reproductive tract, with both testes being depicted in this portion of the photo, and then the epidermis is here and the penis is here. The female usually has one calf every 3 years after a 12-month gestation. The uterus of a female manatee is depicted here with the two horns and the ovaries carrying quite a few follicles, small follicles. The plastation is that of a diffuse plastation, as on a comparative basis seen in the horse and the pig, and here is evidence of such a pregnant animal with almost the mature fetus within the fetal membranes. During the first years of compiling data for the mortality of manatees, it became evident that the number one category of cause of death was due to boats and or barge collisions, in particular the propellers. Another category, altogether on this one 21%, another category was related to drowning associated with canal locks and dams in the southern part of Florida. Other human-related categories were exemplified by poaching and the dependent calf, and the calves are staying with the mothers up to 2 and 2.5 years in the early phase phases of a development are very susceptible to a unfriendly environment that starts with cold snaps or something like this, and only a few animals were dying of what appeared to be a natural disease, and again a large percentage of animal deaths remained simply undetermined due to decomposition and too late a performance of necropsies. I would like to give you some evidence of some of the main categories of cause of death, starting with a environmental problem that relates to too many and too speedy boats, resulting in fatal traumas to the animal. And here's such a animal, dead animal, that shows propeller scars in various areas that probably led to a septicemia, because these are deep enough to connect with the abdominal cavity. And even if animals survive, they all have evidence of encounter with boat propellers by multiple pattern of dermal scars that have healed. Again, a gruesome picture of a trauma resulting from a boat collision, resulting to multiple fractures associated with the calvarium and fatal brain hemorrhage, as seen here with the back of the head of the animal being at this part, the nose up front, and here are the occipital condyles. Internally then, the fractures bones resulted in a multiple areas of brain hemorrhage and luckily immediate death of the animal. Others are hit and induce evidence and show evidence of chronic trauma. This was an animal that became paralyzed in the back due to the fact that there was a subluxation of the two vertebral body and an excessive callus formation, resulting in inflammation and infection of the spinal cord and a myelitis of the spinal cord. Other animals, when trapped in canal locks or dams, simply drown, and here is a set of lungs from a manatee that drowned, being largely fluid filled and causing extravasation of red blood cells. A second category is environmental as well, and results from cold snaps, long cold snaps, particularly in the winter months, whereupon certain groups of manatees, particularly the subadults, go in a nutritional deficiency and hibernation, where they really take a nutritional nose dive. They originally live off their body reserve, but ultimately die because of starvation. They stop feeding, and these animals typically will show evidence of serous atrophy of fat, as seen here, associated with the coronary grooves. Here's a piece of spinal cord. The epidural fat tissue has vanished and is replaced instead by watery fluid, and here is evidence of absence of mesenteric fat, and instead it is also showing some watery fluid. So these animals typically belong to the group of subadults and stand out clearly if and when it relates to cold snaps in the winter. Another type of environmental disease that led to die-off was due to red tide. And the animals that died on a larger scale were clustered around a certain area in the Fort Myers area on in the Gulf Coast, on the west coast of Florida. And the first outbreak of red tide happened in the early 80s, and a second one just recently, about 3 years ago, where in the same area, unexpectedly, a large amount and number of manatees was found dead. The animals that were necropsied in some instances showed a reddening of the meningeal surface that extended into the ventricles and the brain parenchyma, and or had evidence of particles, water-derived particles in the trachea, and developed what microscopically turned out to be an aspiration pneumonia. This was considered due to red tide, and red tide is result of an excessive replication of dinoflagellates known as Gymnodinium breve that produce a neurotoxin known as bravotoxin. The evidence for red tide associated neurotoxicosis in the 80s was only indirect, in that the number of the dinoflagellates was found to have significantly increased, as was there evidence of increased tunicates, ascidian, in the stomachs of such demised manatees. The second outbreak that happened 3 years ago and resulted into a episodic of roughly 200 dead animals in the Fort Myers area was also thought to be result of red tides, and indeed was proven to be the case at the University of Miami through showing that mice inoculated with tissues derived from these dead animals died very soon, but also had evidence of the bravotoxin in macrophages that were specifically marked with antibodies generated against the bravotoxin. This particular slide was provided by Dr. Bossett from the University of Miami and shows a set of peritoneal macrophages and monocytes staining positively for bravotoxin. So this was the ultimate proof, perhaps, or the proof that red tide was the cause of death of this particular group of manatees. And it is a result of a composite of factors. First of all, mild winters and a change in the salinity that resulted in an early seasonal manatee dispersal into the area that has been overgrown by dinoflagellates, and perhaps there may be a special sensitivity of the manatees to the bravotoxin. It was a sad story. Again, it only happened twice within the last 20 years, but it took quite a bit of a toll in that, in addition to somewhat an average and death toll, many more manatees died in a certain era. A third type of environmental disease is associated with fish lines and hooks. Here is such a case of an interoception from a swallowed fish line by a manatee that resulted in peritonitis and opened up. You clearly could see evidence of the fish line and the interocepted portion being a piece of the vitalized small intestinal tissue. A disease that may be a type of disease maybe considered endogenous affected a fairly young manatee, 2 years of age, and was a result of toxoplasmosis. Again, it did not manifest itself at the gross level, so we are looking at a normal manatee brain, but microscopically there was evidence of a multifocal encephalitis, and every so often within the inflammatory foci one was able to demonstrate the pseudocysts of Toxoplasma gondii. The skin of the manatee, if it is not subjected to traumas by boat propellers, can be actively covered by barnacles and show evidence of various proliferative changes. One is result of a fungal dermatitis leading to a crusty nodular proliferation, and on touch prep or true section and specially stained, as seen here in the silver stain, one readily can demonstrate the hyphae of the dermatitis. Every so often the fungi, mainly being Aspergillus, disseminates internally, and here is a set of lung showing thromboembolic mycotic pneumonia with the discrete red elevated nodules being the affected foci. Very recently, the first virus disease was identified inducing a fibropapilloma in the skin of manatees, mainly around the head area, the mouth and nasal areas, and here is such a manifestation of a discrete proliferative dermatitis, microscopically being characterized by ballooning epidermal cells that were shown to be positive for evidence of papilloma virus. Other than that, presently other viruses have not been demonstrated to cause diseases in manatees, or for all purposes antibodies to viruses have not overwhelmingly demonstrated. And here is a scenario whereupon manatees are shown to be surveyed from the air, and indeed this is the case. It is still enlisted as an endangered species, and consistent counts are made, particularly in the winter months, whereupon manatees conglomerate towards the effluent of power plants to have a warm environment. The manatee is a animal that can be compared to a marathon swimmer. It swims over long distance. It is an animal that has a memory that sends it into a certain era, and it is always the same type of manatee or manatees that can be found in certain areas around the warm waters of power plants in the winter month. And here is such evidence of a small group of manatees clustering in shallow warm waters. And here again a picture of a happy and healthy animal manatee. They are radio colored and in some instances have been shown to swim over a long distant area, the longest one venturing all the way into the coastal waters of Rhode Island. But then on to a few other marine mammals, dolphins. This is a striped dolphin that was found beached in the Gulf of Mexico in the Panhandle era, and had large necrotic changes associated with the brain. A set of coronal section through this dolphin brain readily shows various areas of necrosis affecting the gray and white matter substances, causing a collapse of brain parenchyma. This was the result of a fluke, nasotrema in particular, and we are looking at a section through the brain and in particular the cerebellum, where in the meningeal era a adult fluke is seen in being embedded by an inflammatory reaction, and many fluke eggs are also appreciated. This again is nasotrema, the brain fluke of dolphins, and publications of such affected animals exist in the literature. Just a demonstration example of a female reproductive tract of such a dolphin. Okay, then on to whales. After we have covered diseases of manatees and dolphins, obviously the animals become bigger, and whales are very difficult to transport once they beach themselves off the shore to inland facilities, but on occasion that was the case as far as my interaction with various biologists and zoologists are concerned, and whales. Here we are looking at the head of a young adult pilot whale that was found stranded on the Atlantic coast of Florida and came to Gainesville for a necropsy. Again, as has been suspected, parasites were desired to have caused or be involved with mass stranding of whales, and these parasites were either associated with ears or sinuses, pterygoid sinuses very close to the ear and or brain. And doing a necropsy of a whale certainly had this focus in mind, and we are looking at the separated head and lower jaw into the area of this particular pilot whale that is supposed to contain the pterygoid sinus in order to give you directions in what it takes to specifically examine this particular structure for evidence of nematodes, and these indeed were nematodes that are defined as Stenurus species that were found in this particular sinus and or the brain. Here is the brain of one of the two pilot whales that shows a hemorrhagic surface, and on cut section shows evidence of a hemorrhagic necrosis and a fairly large nematode known and defined as different Stenurus. The same were also found in the inner ear and pterygoid sinus. Here is a second pilot whale with a fixed brain that shows a hemorrhagic appearance on the surface to a lesser degree, but we were also able to tease a few of these nematodes off such affected brain. So this was an ideal diagnosis for a parasitic encephalitis, otitis, and sinusitis. And here again, evidence of and for direction to look for the pterygoid sinus. Here is a section through this sinus microscopically. One of the two whales was pregnant, and here is the pregnant amnion, and here is the fetus. And whales have a lobulated kidney with some kidney worms seen on occasion, and this is one of the few right whales that were found as stillbirths with a large, significant, impressive tongue and evidence of hemorrhage due to dystocia. And a sperm whale, rightly so defined as sperm whale, as in that the intra-abdominal testes are very. Okay, then I'm still with you as long as you're still bearing with me. We have covered quite a few animal species thus far, and I would like to continue with those that are crawling on the land and in some shallow waters. And I would like to start with and continue with diseases affecting amphibia and reptiles. The first group of animals represent snakes. However, I would like to make you familiar with some diseases affecting tortoises and turtles, a little bit on frogs, and finalize the presentation with diseases affecting alligators and crocodiles. So let's start with snakes, and here's a list of those that I'll have pathology with quite a bit on boas and pythons and other species as well. And dead snakes are actually pretty. I guess those alive as well, if you have a good feeling for. I do not, but I certainly like to take pictures of dead snakes because of their unique color and color pattern. Here is a whole body view and photo of a green emerald boa showing the top here and the belly portion here. This is a Burmese tree python that either has a yellow color or a green color, as we will see. This is a rat snake, and here we have an albino corn snake that is probably quite well visible in its environment. And here's a coral snake and the pattern, its color pattern has to be differentiated against the king snake, the coral snake being a very poisonous snake, and it certainly will not pay to catch it or put up a fight with this snake. Once it strikes, it releases a neurotoxin that kills quite rapidly. Here is a Burmese reticulated python, a beautiful animal that may be quite large, anywhere between 4 and 40 kilograms and measuring between 9 and 12 feet as far as the adult is concerned, male and female. And here is a variant known as Burmese amelanocytic python. It has very little pigmentation and almost looks like an albino, but isn't. We had the opportunity to perform investigative necropsies on some of these Burmese pythons from a breeding stock, animals that were considered quite valuable and typically developed at the tip of the tail a gangrenous dermatitis and a dark black discoloration. This was the result of multiple thrombi associated with the aortic arches. And in order to understand the anatomy of the heart and the great vessels, one has to be aware that the normal snake heart is composed of one ventricle and two atria, and has two aortic arches that emanate from the atria and one pulmonary outflow tract or artery. And as it relates to the aortic arches, these affected pythons were seen to develop massive thrombosis and thrombi that showered little emboli into the circulation to become entrapped at the tip of the tail, where the circulation became an end circulation. The ventricle, being mainly one cavity, however, is divided in a larger cavum dorsale and a smaller cavum ventrale that mimics somewhat the biventricular system of the mammalian heart. Again, these animals were quite large, heavy, weighing between 4 and 40 kilograms and measuring between 5 and 9 feet. Another thrombotic intravascular thrombus associated with one of the aortic arches is depicted here, and again the vascularization or the emanating arterial larger arteries are depicted in this picture as well. As expected, a occlusive phenomenon such as this will lead to circulatory disturbances that result in fibrotic, cirrhotic associated major parenchyma, as seen here in the liver, mimicking somewhat what's known as nutmeg liver. So this is cardiac cirrhosis. These animals are viviparous, and for you to show is one reticulated normal pattern of such a reticulated Burmese python, and 2 amelanocytic at this level, almost albino-like snakelets, if you want, in addition on either side of the middle snake, and all of them having attached to them a yolk sac. True changes associated with organs are coming up now. Here is a opened lung of a snake showing a loose liquid exudate, yellow and red, suggesting a purulent bronchitis and bronchopneumonia. Here is a more dry exudate and purulent inspissated pus, suggesting a purulent bronchopneumonia. And indeed, microscopically, regardless of the cause, such an inflammation is characterized by the presence of heterophils and a coagulative proteinaceous material distending the airway, as seen here. 2 segments of intestinal tissue showing a membranofibrinous enteritis due to salmonellosis, and the changes at the microscopic level are characterized by a coagulative necrosis of enterocytes and intestinal tissue, and especially gram-stained reveals a magnitude of gram-negative organisms that were identified to be Salmonella. A very interesting viral disease has been described as inclusion body disease of Boyd snakes that affected both pythons and boas, and is characterized microscopically by the formation of huge Maganda-like inclusions, cytoplasmic inclusions, as seen here in the liver, almost assuming the size of a hepatocyte nucleus. These inclusions are seen in all epithelial structures of such affected snakes, and also in the brain. It is supposed to be a retrovirus that is affecting these snakes, and as it relates to the GI tract, the infection with such virus can be diagnosed by taking biopsy samples from the stomach and or duodenum and looking for these huge, beautiful, huge Maganda-like inclusions. Again, a retrovirus disease. Here we have a brain. The animals typically will manifest signs of CNS disease. One, however, has to be quite knowledgeable on snake behavioral changes in order to make this assessment, but astute clinicians can identify a snake that suffers primarily from CNS disease. And here we have a segment of a brain to show Maganda, multiple Maganda-like inclusions associated with neurons, or cytoplasm of neurons, and I suppose they also have been described associated with glial cells. Again, the disease is known as inclusion body disease of Boyd snakes. This is a case, a reproductive tract from a larger snake to show evidence of a salpingitis and also a necrotic scenario with the uterus, due to some kind of inflammation and infection. Here is the skeleton, the vertebral system of a cobra snake to show an osteomyelitis affecting the vertebral bodies and inducing a osteonecrosis and osteolysis and a disfiguration of the vertebral bodies as compared to a uninvolved rib scenario. Here's a case of sclerosing discospondylitis or spondylosis affecting portions of the vertebral column of another snake. A blue indigo snake to show a hepatitis which mainly is of bacterial origin or can be fungal as well if it shows evidence of a granulomatous inflammatory response. And again, the fungal infection is a result of the presence of aspergilli. A proliferative change associated with a mucosa of the stomach is diagnosed as proliferative gastritis and is the result of cryptosporidiosis. And indeed, in addition to the magnitude of mucosal proliferation, the surface of the mucosal lining is studded with cryptosporidia as seen here in this photo micrograph. On to rattlesnakes, a very ubiquitous distribution throughout the middle portion and southern parts of the United States and elsewhere. Excuse me, Florida is no exception. However, an encounter with such a snake may be fatal, or at least leads to visible evidence, as we will see very, very soon. This is the heart of such a rattlesnake, showing a hematoma overriding one of the atria resulting from an atrial rupture. And here is a dog that had an encounter with a rattlesnake to show a very marked and impressive facial disfiguration despite of its breed and a lot of a swelling of the neck area resulting from a profuse and diffuse and marked extravasation of red blood cell and necrosis of soft tissue associated with these portion of the body. A beautiful case of visceral gout affecting the kidneys of a snake that will then show tophi, gout tophi, occupying and obstructing the lumen of renal tubules and being demarcated by a peripheral rim of inflammation that can show macrophages and multinucleated giant cells in some instances. This was a beefmaster snake showing evidence of a pneumonia, and the pneumonia was the result of some kind of foreign body, the pneumonia inhalation that looked very much like barium, really. The foreign body, whatever the nature of it was, is demarcated by histiocytes and macrophages. Another blue indigo snake had tumor-like tissue proliferations associated with the gallbladder and distal portion of the liver that was thought clinically to be a tumor, either resulting from the biliary system or perhaps hepatocellular tissue. Microscopically, it turned out to be an infected hematoma showing evidence of entrapped heterophils and fibrin in a laminated fashion and multiple gram-negative bacteria which were not cultured. So this was a bacterial hematoma that mimicked very much a neoplastic proliferation. Neoplastic growths have been described in snakes in various types. I just have two examples to share with you. This is again a Burmese rock python that looks very much like a Burmese reticulated python, showing multiple nodules associated with various internal organs. Here we have portions of the intestine and liver removed to show multiple white, discrete, somewhat firm nodules. Here's a couple of them within a piece and segment of intestine on the mucosal surface. A couple of smaller ones here. Here's a larger one that microscopically were diagnosed as a histiocytic lymphoma. And here is an example of neoplastic round cells that led to this type of diagnosis. Here is the opened mouth of a snake to show a neoplastic growth associated with the soft tissue of the oral cavity that was diagnosed as a fibrosarcoma. And here's a corn snake opened up as far as the esophagus is concerned, showing a distension and enlargement of the esophagus and some fleshy cauliflower and solid white tissue that turned out to be a adenocarcinoma originating from the lining of the esophagus, and did show in some of the cytoplasma of some of these cells evidence of what appeared to be viral inclusions. I would like to continue and also to finish up with describing some diseases that may affect tortoises and turtles. And here's the group of actors involved in disease entities, and some of them probably will arise interest and hopefully interest you as well. And let's then continue and start with the Galapagos turtle. That is a impressive animal in that it can be quite large. Here is such a 25-year-old Galapagos turtle, but some of them may become as old as 50, 60 years of age. That I had the opportunity to perform a necropsy on. The heart is interesting in that it just doesn't look like a heart and is composed of two diverticular-like structures. And the males have intra-abdominal testes that really do not look like testicles as well. The ones that I was performing a necropsy on had changes associated with the liver, despite of the fact that this liver appears to have a expected color of showing a lipid, normal lipid. It has evidence of fibrosis that sort of causes a accentuation of lobules or lobes, and indeed this was a case of hepatic fibrosis microscopically. Here is another one that we just recently necropsied that stopped eating because it became impacted and had a liver that was swollen, very friable, and revealed hepatic lipidosis secondary to starvation. Turtles have a solemic cavity and a fairly large intestinal tract, as opened up here. In some of the turtles, particularly as far as certain lakes in Georgia are concerned, shell disease was found. These were river cooters and yellow-bellied turtles that revealed in their shell discrete areas of osteonecrosis, very friable tissue that in very severe case sequestered off and caused cracks in the shell, and a various section through the shell reveals various phases of necrosis and inflammation. The cause for this shell disease was not identified, unfortunately. Here is another yellow-bellied turtle from a same lake area that shows early phases of the disease, as you can see here as well. And this is a snapping turtle that also in some instances had a similar disease process, though this one is quite a normal turtle. Parasites in the intestinal tract, stomach, frequently are ascarids and may or may not induce a gastroenteritis. Liver from a turtle showing multiple abscessations, most likely fibromatous in origin. Sea turtles or loggerheads have been reported certainly in the Caribbean, but around the world in waters surrounding Hawaii to develop fibropapillomas. This is an unaffected sea turtle for comparison. Here's one that has a lot of barnacles, but below has evidence of fibropapillomatosis affecting the soft portions of the head and neck area and the flippers. Here's another one to show the proliferation precisely as discrete nodules, and if it affects the conjunctiva, it may grow over the eye. These animals then typically will become blind, will get lost in their environment, and also will starve due to the incapability to feed. The fibropapillomas may be seen also internally in various viscera. This is just an opening of an exteriorization of the viscera. They may affect the mucosa of the stomach, as seen here, this being the esophagus. It is normally characterized by a dense papillation of the mucosa. We'll see such a scenario very shortly, and should not be confused with tumor proliferative lesions. Here is a proliferative change associated with the lung, and here with the kidney, and microscopically here in the lung one can have evidence of a twofold proliferation, or a proliferation of two different types of tissues, connective tissue and epithelial tissue, truthfully making it a case of fibropapillomatosis. We do not know what the reason is, but we are highly suspicious of herpes viruses being involved, perhaps in the induction of these tumors. However, they do interfere with the livelihood of many of such green sea turtles or loggerheads. This is a portion of the esophagus of a sea turtle to show the papillation of the mucosa to increase the absorptive surface of the esophagus. It should not be confused with fibropapillomas. It is a normal appearing mucosal surface of the esophagus of these animals. Amphibia, a few scenarios as far as individual species are concerned. A frog showing a ulcerative hemorrhagic dermatitis with a lot of raw flesh, being the result of an infection with Cladosporium. A second one showing red leg and some kind of macules and pustules, and some hemorrhage and some swelling, being result of Eromonas. And another one showing a distension of the abdominal cavity, being result of a tumor originating from the kidney, known as Leukotrichia tumor resulting from herpes virus infestation. Here is a cleaved African cleaved frog showing a diffuse swelling of the body mainly, but also the hind legs. And here's another one being the result of an effusive accumulation of water-like substances that also filled up the abdominal cavity, leading to the diagnosis of anasarca, cause unknown, perhaps maybe also resulting from some kind of bacterial septicemic disease. Another frog showing evidence of emaciation, being result of endoparasitism. Chameleons, all kinds of them can be seen. This one has a poor color distribution, despite the fact that there are supposedly changing colors, some evidence of dehydration and maybe some evidence of ulceration, suggesting some kind of infectious disease. Here was one that had enlarged ovaries resulting from an infiltration by neoplastic lymphocytes, leading to the diagnosis of lymphosarcoma in the ovary, but it also involved other organs as a heart here. So a case of lymphosarcoma, multicentric, affecting various viscera of lizards, is a species of animals that has a all familiar tumor and behaves quite the same as we see in this particular tumor if it occurs in mammalian species. Iguanas are popular pets. The number one disease that they suffer from are nutritional in origin, nutritional osteodystrophy, leading to disfiguration of extremities and the skeleton. On to the last group of animals, alligators and crocodiles. alligator. The alligator is the mascot of my university, the University of Florida, and everything is centered around and focused on alligators. As far as this animal is concerned, for a while in the state of Florida, alligators were about to become endangered as a species, but they have achieved the miraculous turnaround. They thrived very well, replicated very well, and are now open for hunting during certain periods of time. I personally have had not too much of an exposure to alligators. These are mainly done, as far as necropsies are concerned, by biologists, state biologists, and we have very little exposure to them. Every so often a legal case of a alligator having killed a young person or a dog comes our way to identify the consumed bones. So I do not really want to end this video on a sour note, but alligators are endangered as a species, or were endangered as a species. They came back quite successfully, but they are a danger still to mankind and their pets, in that every so often they become aggressive, a nuisance, and need to be killed because they do attack swimmers, human beings, and pets as well. There are crocodiles as well in certain parts of the Everglades. This is a Everglade crocodile. The difference between a crocodile and an alligator is the head. Here's a crocodile head, here's an alligator head. And it always behooves me and amazes me and surprises me how small the alligator brain is. These animals can measure quite a bit. They may become very lengthy and weigh quite a bit, despite they have a very small brain. It's very difficult to remove because it is barely visible, but here is the head of the alligator, here is the calvarium, and here is the small brain, which is of expected normal size. So alligators don't need to do that much other than, I guess, every so often fight, mate, and swim, and I guess that is enough of a brain in order to guarantee these functions. Here is a compression fracture in an alligator, showing evidence of callus and a discospondylosis interfering with the spinal column, probably impinging on the spinal cord and maybe paralyzing of this animal in certain portions. Here is a hematoma associated with the heart from a rupturing heart vessel or an atrial tear in an alligator. This alligator head shows some erosions and lack of pigmentation in these areas over the nose, being result of a dermatitis. Here is another loss of alligator skin due to ulceration and necrosis. This also is a bacterial dermatitis. And here we have an alligator that developed gout with urate precipitation involving a joint opened up here and various other joints, most likely interfering with swimming and or walking. There are alligator farms that keep alligators for display purposes, and in one of such farms many alligators died unexpectedly and came to necropsy in order to find out the cause of this die-off. Here is the opened lung of an alligator, such dying or dead alligator from that farm, not really showing overwhelmingly much of pathology, other than maybe a little reddening and excessive red fluid, suggesting some kind of bronchopneumonia. And indeed, it was a acute exudation and inflammation, being more characterized by the presence of edematous fluid separating lung structures, and a little bit of an inflammatory response being characterized by heterophils, lymphocytes, and neutrophils. That, however, was seen in other organs as well, such as the heart here, but the liver, spleen, and brain showed inflammatory processes. This is a section through the liver showing a very subtle type of inflammation with some necrosis and separation of hepatocytes. Many of these animals were culture positive for Mycoplasma species. We do not know which biotype of Mycoplasma it was, but they cultured positive, certainly the fresh ones, for a uniform isolation of Mycoplasma in these various organs. So some kind of mycoplasmosis was thought to be responsible for this die-off on the alligator farm. Alligators may become quite old, up to 70, 80 years, at least those that are in captivity. And the older they get, the more lazy they probably get, but if and when fed adequately, in addition to a lack of exercise voluntarily or forced, leads to a fat alligator. And here we have the heart sac opened of such obese alligator to show the magnitude of adipose tissue associated with the coronary groove. So this is cardiac lipidosis affecting the heart, and might have been the result of the death of this particular chap or not. I do not remember. Anyhow, obesity in alligators on occasion can occur. Here is a piece of bone and fat showing some kind of necrotizing inflammation. This was a sterile scenario thought to result from a nutritional deficiency disease. Egg peritonitis does develop in female alligators on occasions to introduce a disseminating peritonitis. I'm at the end of my presentation, but the presentation would have not been possible, be it through contributions, through various colleagues of mine, and I would like to acknowledge the contribution of these individuals, which on the left are from the University of Florida. Many of these are from my department. These are various specialists, virologists, parasitologists, and pathologists on the right. A group of people that is involved with manatees as far as Dr. Bondi is concerned, Dr. Bossart. Dr. Taylor is involved with the Florida Panther project, and so is Dr. Wright. So it wouldn't be without these colleagues that I would have not been able to come up with this presentation. And I have reached the end of my presentation, and I would like to thank you for your attention. Thank you very much.